Hello, everyone. Welcome and thank you for attending the NAN Project presentation of suicide risk factors and warning signs, what to look out for during COVID-19. The NAN Project is an initiative dedicated to empowering both educators and students to have an open, safe conversation about mental health struggles, to recognize the risks and the warning signs of suicide, and how to help a friend or yourself who may be struggling with a mental health challenge. My name is Donna Kosick. I'm the clinical director of the NAN Project, and I'd like to introduce you to the two co-trainers today, Lizzie and Shilpa.
Hi everyone, my name is Lizzie McClellan and I'm the Senior Peer Coordinator for the NAN Project.
Hi, my name is Shilpa Thirukova-Lore and I'm a Peer Coordinator for the NAN Project.
So right now we're not able to have the same conversations around suicide or mental health that we normally be having in your community, but we'd still like to spend some time covering the risk factors and warning signs around suicide, especially how we think they might show up in our current situation. We're not expecting or intending anyone to leave this video and feel ready to offer counseling or crisis services. We're also not trying to add one more thing to your plate. We're hoping this video will bring an extra level of awareness to the important work that you're already doing with students now and in the fall. Before we begin, we want to acknowledge that whether or not suicide has affected you personally, talking about this subject can be hard. If you find yourself needing a break at any point during the video, go ahead and pause. It'll be here when you come back. If you think this video might be hard for you to watch, why not pause right now and let someone know to check in on you in about half an hour when the video is done. Whatever you need for self-care comes first. If at any point during the video you find yourself feeling unsafe, one resource is on screen now. The National Suicide Prevention Lifeline is available 24/7 if you want to talk.
Something to keep in mind is that in the US, suicide is the second leading cause of death for those aged 10 to 34. This is from before COVID-19, and now it's even harder to access support. Even though it's too early in this crisis to have a lot of statistics, deaths by suicide are likely to increase. A federal emergency hotline for people in emotional distress registered a more than 1,000% increase in April 2020 compared with the same time last year. 1,000% is a huge rise, and while this is worrying, this also shows that people are reaching out for help and support. Since we don't have concrete numbers on this pandemic yet, we thought it would be helpful to look at similar outbreaks and suicide rates during those times. During the 2003 Sars epidemic in Hong Kong, suicide rates were at a record high, especially significant among older adults. U.S. Census data during the influenza epidemic shows increases of suicide rates at the peaks of the epidemic, thought to be the result of social isolation and the fear surrounding the disease. The Wellbeing Trust predicts 75,000 additional deaths by suicide, alcohol, and drug overdose by 2029.
So we'll start by covering some of the known risk factors for suicide. A suicide risk factor is a characteristic or a condition that increases the chance that a person may try to take their life. It's not the same thing as a cause, and people could have multiple risk factors for suicide and never become suicidal. We're used to thinking about risk factors for physical health. For example, if you know that you have a history of heart attacks in your family, you're going to take that seriously and watch out for some of those signs in yourself. This is the same kind of thing, but more so for mental health. Some of the risk factors that we're going to talk about are probably going to get you thinking about our current situation with COVID-19 and social distancing, and that's why we feel it's so important to talk about these things right now. We're going to break our risk factors into 3 categories: physical, environmental, and historical. Some risk factors are more physical. So for example, we know that a physical health concern that's very serious raises somebody's risk. Mental health is also important. People with mental illnesses or mental health challenges die by suicide more often. That could be anxiety, depression, self-harm, or an undiagnosed mental health challenge that hasn't been recognized yet. Substance use and abuse raises risk for suicide as well, so that's something to keep an eye out for as we start our summer. Social distancing and stay-at-home guidelines have probably changed a lot of people's access to alcohol, so as those guidelines are lifted, keep an eye out for substance use and abuse. Not being able to receive medical care, behavioral health care, or mental health treatment also raises somebody's risk. If you know that some of your students regularly receive treatment or support from a doctor or a therapist, that has probably looked really different these past couple of weeks. Not everyone has been able to utilize or access telehealth in the same way, so it's something to keep an eye out for and to check in on. Past experiences can also raise somebody's risk. These might not be things that you know about all or most of your students, but it's something to keep in the back of your mind if you become aware of them. Someone who has past suicide attempts is at a much higher risk of death by suicide, as well as people who've been exposed to suicide through peers or a family history. We also know that adverse childhood experiences, or ACEs, and trauma raise somebody's risk as well. The past couple months have presented a lot that could have been traumatic for some of the students that you know. Experts are saying that when students return to school in the fall, whether that's in a physical classroom or virtual, they'll be returning with a lot more trauma than they left school in March. You might be seeing some of that already, so it's important to keep an eye out for.
Thanks, Lizzie. Risk factors are often confused with warning signs, but the two are very different. A risk factor suggests that someone is at heightened risk, but not necessarily in crisis. Our hope is that more people can recognize the risk signs before a warning sign would present. Risk factors tell us to keep a watchful eye, offering an intervention. Warning signs indicate an immediate risk of suicide. A warning sign to look out for when you're concerned that a person may be suicidal is a significant change in behavior or the presence of entirely new behaviors. This is of sharpest concern when the new behavior is related to a recent loss, a change, or a painful event. Most people who take their lives exhibit one or more warning signs, either through what they say or what they do. Warning signs are a call for action. So as Lizzie said earlier, this is not our regular suicide prevention training, but we did want to offer you the next 3 slides from the American Foundation of Suicide Prevention that really puts into categories and helps you to think about someone that you may have concerns about. The first warning sign is their talk. Are they actually saying, I want to kill myself? Are they saying, everything is just hopeless. I have no way out. I have no reason to live. Are they saying, I feel like a burden to my family? These are significant words, and it's our responsibility to listen and respond to this language. It's one of the warning signs that clearly states it's time for an intervention. The next group that the American Foundation for Suicide Prevention gives us is people's behavior. Again, if it's a behavior that is new or increased and can be related to a painful event or a loss or a change, it's something to pay close attention to. Is there an increase in drug or alcohol use? Is there a start of drug or alcohol use? Is this someone who is searching the internet for a way to die? In emergency services as a clinician, I spoke to many kids who said to me that they found on the internet the easiest, least painful ways to die. So if someone's searching for that, we need to pay attention. Another behavior sign is if they're just isolating and withdrawing, if they're suddenly not enjoying what they used to enjoy. This is a red flag. Is it someone who's eating too much or eating too little? Are they sleeping too much or sleeping too little? Significant change in the basic needs schedule can tell you something. Is this someone who is normally pretty low-key and now they're angry all the time? Most teens are irritable. It's part of being an adolescent, but this is when the irritability, you just can't shake it. So irritability, fatigue, anger, behavior changes that we want to pay attention to. And then another behavior change is if suddenly they're saying goodbye to people, giving away their prized possessions. This is a message that they have a plan. So we want to pay really close attention to these behaviors. And the final warning sign is in relation to mood. People who are considering suicide often display one or more of the following. They're much more depressed. They're much more anxious. Again, that loss of interest, things that used to interest them doesn't interest them anymore. They're irritable, they're angry, and show much shame. And shame about something they have done or something that was done to them. One other part of mood that you'd want to pay attention to is relief or sudden improvement. That more means that someone has a plan and they're ready to enact it because no one recovers overnight. Treatment for anxiety, depression, any mental health disposition takes time and takes effort. There's no immediate cures. So if someone is telling you they're all better, no problem, that would be more of a cause for concern. Another key point for teachers and social workers and school adjustment counselors to be on the lookout for is if you hear of students who are just not joining any calls at all. They're not joining calls from the teacher. They're not joining calls from their classmates. They're not engaging in any social activities where they used to be socially active. You may see that your student looks exhausted. You may see that it looks like they haven't showered. Maybe they're in the same clothes that they've had all week. Maybe they're presenting as just a little more irritable. And of utmost concern during this time is the heightened anxiety that your students are carrying. We know from talking to students and teachers that students are really very worried about their getting sick, their family getting sick, if they return to school and make a teacher sick. They're worried about the losses that they've incurred during this time of quarantine. And it's really a loss of potential and opportunity. Think about those kids who wanted to get into the AP class next year. They've lost months of work. Think of the kids who wanted to use this time to work out and make a varsity team next year. So kids are looking at this through a trauma lens of all that they have lost. The other warning sign that we have heard, and this is significant, is that people have stopped, both children and adults, their behavioral health appointments. Today, most of those appointments are held through telehealth. It makes sense. It's hard to talk into the computer. It's particularly hard if this is a new provider. They don't know you. You don't know them. So as a result, some students are just stopping their therapy. This is a dangerous sign for both adults and youth.
If you would like more information on how to help a student in crisis, please listen to our webinar, Ask, Listen, Get Help, Responding to Students During COVID-19, linked here.
And if in your interactions with your students, if you see any of the following, get help immediately. If you hear someone talking about being a burden, being overwhelmed, research has told us that burdensomeness is a strong warning sign for a possible suicide. If you're hearing your students say something like, the world would be better off without me, my family would be better off without me. Helplessness and hopelessness, a feeling of no control over the future. And think about this through your students' eyes. They have no control when school's going to start, what school's going to look like, who their homeroom teacher will be. How do they establish a relationship with their friends and teachers when it's all through Zoom? A feeling of total helplessness. You may be hearing unbearable pain, unbearable distress. These are a call for help. And of course, if you hear anyone talking about a plan, looking for a plan on the internet, looking for lethal means in the internet, this is an immediate call for help. Have your school policy available, have your resources available, and answer that call.
We've included some useful hotlines for your reference. All of these hotlines are 24/7. Something to keep in mind is that you don't need to be in a crisis in order to reach out to these hotlines. They're there to support you and to refer you to the appropriate resources. If you're looking for Spanish speakers, National Suicide Prevention Lifeline offers services in English and Spanish. If you prefer texting over calling, we've included the Crisis Text Line. The Steve Fund Crisis Text Line is a hotline specifically for people of color. For LGBTQ+ folks, the Trevor Project Lifeline is available 24/7, and for trans folks, the Trans Lifeline is also available. If you need help navigating the mental health system, we've also included the NAMI Mass Compass Helpline. We've also included the number to find your local emergency services provider.
Thank you for joining us today. For more information, please check out our website, thenanproject.org. And if you'd like more information with resources specific to mental health and COVID-19, please take a look at our website. Thanks again.